helping those without health insurance to get coverage certainly is a very noble goal, but the method that was used to achieve it under Obamacare has just done so much more harm than good. And a very vivid example of this is the provision that we're talking about today that requires employers to provide health insurance for any employee that works 30 hours or more a week. Their thinking must have been that more part-time workers would receive employer-sponsored care and that employers would not change their behavior, simply they would absorb these new costs. Well, I guess when you think like the government, maybe you would think that. You're unconcerned about costs, you're unconcerned about balancing your books, and so that thinking sort of makes sense. But in the real world, it just does not work. Employers need to live in the real world. They're in business to make money and they have to balance their books. And these very onerous provisions of Obamacare make it very, very difficult for them to continue with business as usual, to comply with the law, and to stay in business. So employers have been forced to cut workers' hours. And we also need to look for a moment, Madam Speaker, at those who have been most negatively impacted by Obamacare and this particular provision of it. According to a study done by the Hoover Institute, the 30-hour rule puts 2.6 million workers with a median income of under $30,000 a year at risk of losing their job or having their hours cut. And guess what? 89% of the impacted workers do not have a college degree. 59% are between the ages of 19 and 34, and 63% of these workers that are so negatively impacted are women, Madam Speaker, women. So this rule impacts the most vulnerable in our economy who are just starting to make their way in the world or who are working hard to support their families. And you know, I didn't need a study to actually tell me that because I am hearing it directly each and every day from those that I am so proud to serve. And I will just give you one example, a vivid example of many, many that we got, especially women who have contacted my office. This is from a mother named Tracy in Macomb County, Michigan, who said, "My daughter is a single mom and struggles to make ends meet. She's had her hours at work cut by over 50 hours a month, so that her company doesn't have to provide her with health care. So she is now looking for a second job, which means less hours for her, so she is and less time, of course, that she is able to spend with her children." And Madam Speaker, being a single mom is tough. It's really tough. And what we do here in Washington shouldn't make it tougher. And being a small business owner and a job creator is tough. And again, what we do here in Washington shouldn't make it tougher. The 40-hour work week has been the bedrock of our economy for decades, and workers and families have come to depend on it. That is, of course, until Obamacare changed the rules. It's time for us to correct this mistake and repeal this terrible provision, and I yield back the balance of my time.
The gentlewoman's time has expired. The gentleman from Washington is recognized.
Madam Speaker, I yield to my good friend from California, Mr. Miller, 5 minutes.
The gentleman from California is recognized for 5 minutes.
I thank the gentleman very much for yielding, and I rise